Okay, good morning, good afternoon, and good evening, everyone, wherever you are. Thank you so much for joining us for our third live forum in a series called Understanding COVID-19. And today we are talking about maintaining commitment for immunization in Africa through COVID-19 and beyond. And we have an excellent panel of speakers with us who I will introduce in a moment. And my name is Rachel Ndirangu. I'm the Regional Policy and Advocacy Officer at PATH, and I'll be your moderator today. But before we get started, I just want to run us through a few logistics. We want to hear from you during these conversations. So please share your questions, your comments with us by submitting them in the chat box. Thank you for those who are already signing in and saying hi and where you're coming from. That's really positive. So make sure that you're doing that at any time through this presentation. I will also be monitoring the chat box and we'll be saving the majority of this hour for questions. I also want to invite you to join the conversation online by tagging us at PATH Tweets, PATH Advocacy, and we're using the hashtag VaccineWorks. So please make sure that you pick any insights on the conversation and put them out there. This call is being recorded just for you to know, and it will be distributed for those who are unable to attend. And I want to really thank everyone for joining us today. And thank you for all the work that you're doing for our communities right now, both here where I am in East Africa, Nairobi, and also globally. So we want to make this conversation, this discussion today, a conversation. And therefore, we're going to follow a question and answer kind of format. We will have our videos up for the speakers as opposed to slides. So don't expect any slides today because we really want to make this conversation. And for those who are less familiar with PATH, I just want to give a very, very quick overview of PATH, that we are a global team dedicated to achieving health equity so all people and communities can thrive. Together, we are driving public health solutions that meet the most pressing needs of families, communities, and countries. And we are a global team working in 70 countries around the world. Our specialties range across health systems, diagnostics, drugs, devices, vaccine research and development, and policy and advocacy. So today's discussion will dive into learnings from across the Africa region on how to mitigate the current and anticipated impacts of COVID-19 on access to vaccine and immunization services. And most importantly, how do we sustain commitment to ensure that access to immunization services for everyone who needs them is actually a reality? We know that Gavi, the Vaccine Alliance, and we are glad to have a speaker from Gavi, has reported that 14 national campaigns against vaccine-preventable diseases such as polio, measles, cholera have been postponed as a result. 13.5 million across the globe really are at risk of missing out on vaccination. And I'm sure from wherever you are, you can identify with some of these challenges, either personally or within your community. If you're working within the health sector, you can really identify with this. And so we are very fortunate to have this excellent panel of speakers, including Dr. Marthe Essengue, the regional head of Francophone Africa for Gavi, that's the Vaccine Alliance. We also have a speaker from the Ministry of Health in Uganda, who is the manager for Uganda's National Expanded Program on Immunization, EP, Dr. Alfred Driwale. We are also going to hear from Fred Njobvu. He's a Health Systems Innovations and Delivery Manager for PATH in Zambia, working on better immunization data program. We know that data is key. So we are looking forward to a great discussion with all the panelists. And we are going to just start very quickly with a few remarks from Dr. Essengue. And so I'll bring you in, Dr. Essengue, and thank you very much for availing yourself for this discussion. As you know, that African Vaccination Week, which also coincided with the World Immunization Week, was just last week. And so I wonder if you could just kick us off with a big picture question Why is immunization more important now than ever? And as a follow-up to that, how is Gavi pivoting its strategy during this pandemic? And we're glad to have you, and over to you, Dr. Essengue.
Thank you very much, Rachel. Hello, everyone. I'm really happy to participate in this conversation, and thanks for the invitation for Gavi to give its perspective on this COVID-19. I will walk you through 3 different points. First of all, I will talk about how Gavi is responding and what is this importance of immunization in this specific period of time and moving forward, the impact that we see now in the countries and what we hear from countries at this stage. And I will also talk about some of the needs that we hear as well. And I will leave you with a question at the end, where I would also like to hear from the participants to this discussion. I think what I would like to say at the beginning is really that all this conversation is about people. It's about protecting health. It's about preventing diseases and saving lives, which really resonates as far as the Gavi mission is concerned. And I think the situation that we see now with this COVID-19 really brings us back to these questions about how do we really ensure that people access immunization and that they have access to life-saving vaccines. Not only life-saving vaccines, but also at the end, they have access to essential health services, which include immunization. And I think this really also shows the importance of the mission of Gavi at this stage, at this time where we really in the preparing the replenishment of the Gavi in June, 4th of June. This really being on the table, the need for increasing investment on immunization, life-saving vaccines, and making sure that the immunization platform can really cope with introduction of the COVID vaccine when it will be available. And it is the role of Gavi to make sure that when this vaccine is available, all those who are in need really access this vaccine. And that is not only for those who can pay for that. Having said that, given this situation, Gavi immediately reacted by helping countries and allowing some flexibilities in the existing financial resources for countries to be able to reallocate health system strengthening resources to immediate activities related to either protection, material, testing, about communication, and all immediate activities that were needed to make sure that we avoid death from other diseases, but also that we maintain as much as possible and where this is possible, immunization services, avoiding that people die from diarrhea, from pneumonia, from other diseases that might be forgotten during this period. We should remember that during the Ebola outbreak in GRC, we saw an increasing number of measles cases, and we face a huge important outbreak of measles that kill many children. So we should have this in mind, and that should help us in this period of time to really make sure that resources continue to be oriented to ensure that these diseases continue to be prevented. Other flexibilities that Gavi put on the table really was to make sure that the support that is provided through partners 2 technical assistants funded by Gavi, that this could be reoriented and making sure that this partner can support countries in this period of time to face this situation, making sure that they receive necessary needed support for that. And another point where Gavi really look at is about making sure that we monitor the development of vaccine as soon as is available, that everything will be in place so that countries access this vaccine. So Gavi is also monitoring that very closely. We know that the most advanced vaccine now has just gone into the clinical development phase, so we continue to monitor. In terms of impact, as May said, you know, we hear that about more than 3 million people we have more than 3 million cases now in the world with more than 200,000 deaths. What I'd like to say is that among that, 90% of 73 Gavi eligible countries are affected, and we have more than 80, close to 85,000 cases confirmed in these Gavi eligible countries with close to 3,000 deaths, which is not used compared to the rest of the world, but it is important that at this stage we really take necessary actions to make sure that it doesn't become worse. I will also now like to say a few words about what we see in terms of impact and what we hear from countries. We know that at this stage about 80 countries out of all Gavi eligible countries are at risk of stock out of vaccines. So, and given that in 2020, 68 introduction of vaccines plus campaign, as Rachel mentioned, were supposed to happen in this year. We expect many of them will be delays, and in this case, those who are really affected mostly the polio and the measles campaign. And we know that in Africa, we need to make sure that these activities are taking place to avoid the disease that can be caused to avoid the death that can be caused by this disease. In terms of introduction, we know typhoid and rota, so it will be delayed mainly in the region. So again, that also puts some concern around diarrhea, kids suffering from diarrhea due to rotavirus in the region. So these are the countries that are at risk. We are working very closely with UNICEF to make sure that they put in place a mechanism of charter to reduce this impact, this risk of stock out of vaccines. So this is being monitored and managed. Hopefully, we will not get to the level of full stock out. In terms of what we hear from countries, in terms of the need, we know that many countries have continued immunization services, at least in the fixed side, but we also know that in this context, they are not able to continue outreach activities, which we know cover the important part of the target population, and that will necessarily impact on the number of kids or people that are reached with immunization services. And what we also hear from countries is about how can Gavi really and partners support the country to already start the intensify immunization activities. Countries are asking if Gavi could support, because that will go beyond only vaccine supported by Gavi. So this is something that countries are asking, as well as making sure that Gavi, they receive support to keep the immunization platform able to work even after the COVID situation. So for that, Another concern is also about increasing inequities in access. The new strategy of Gavi is aiming to focus on these communities, zero dose, and we know that with this situation, there will be an increasing number of zero dose season. There will be an increasing number of population, and this is something that countries are aware of, and they are already concerned about how this could be integrated in the response right now, even during this period of the COVID time, to make sure that the response is already in place.
Thank you, Dr. Sanjay. Thank you so much for that really great overview. I know we'll come back to some of the points that you have already talked about, and I think you really mentioned about, how vaccine is really essential for everyone. You've also talked about some of the kind of needs you're hearing from countries around support, but also you've talked about how Gavi is already, working with countries to make sure that they are able to still maintain services. I know there are a number of questions that are going to probably and comments, and there are some comments or questions that feedback you wanted to hear from countries. Could you probably, and participant, could you probably now just post that, share that question, invite that question, so that participants can continue putting their, responses on the chat, and then I'll quickly, first of all, just transition to Dr. Driwale, then we'll come back to you. Thank you.
Thanks.
Thank you, Dr. Marthe. I think there's a question you wanted to pose to participants so that they can respond as we move along.
Yeah, very quickly, I think one of the questions that I wanted to put to participants was really about, we know in the region, African region, we are hearing more and more rumors and misinformation about vaccines, about immunization, and these are even worsening now with the COVID situation. So my question is really, what are the strategies that the team, the region, CSO, and all people in the region are putting in place to make sure that immunization will continue and that these rumors and misinformation will not have a huge impact on the immunization going forward? Over.
Thank you. Thank you very, very much. A very, very pertinent question. And I'll ask participants, especially those who are, working with programs, working with communities, health managers, please share your thoughts in terms of what is working and how can we engage communities better to make sure that they have the right information. Thank you so much. So I'll now move over to Dr. Driwale. Thank you very much, Dr. Driwale. I see you're coming from probably another engagement, very well masked. Thank you for that. And we're just looking at, and I just wanted to bring you into this conversation, that if you could just share with us your perspective as a lead of Uganda's expanded program on immunization. What are you seeing in terms of the current and anticipated impacts of COVID on immunization in Uganda, and other vaccine preventable diseases? And just as a follow-up to that, what are the trends and what are the strategies that the government of Uganda is using to make sure that this is mitigated? Over to you, Dr. Driwale.
Thank you very much, Rachel. I should say I'm speaking to you from the field, where we have we identified a case in one of our western districts, and I'm leading the response here in the region in terms of having to identify contacts of that case and having them investigated and deploying the response teams. And I was visited by the Minister of Health and the district and the Ministry of Health leadership in the field. That's why I joined you late, and why I'm in the attire now, which I can happily remove. When the cases of COVID started being identified in our region, as a program, we sat down to do a risk profile for our program. And we were able to find the following. Number one, we found that the stock levels for vaccines was low, and they could only take us up to the month of May, by the end of this May. Thereafter, we would ground to a halt. And we also found that at that time, we had not fulfilled our obligation for co-financing with Gavi in order to front load our requirements. And thirdly, we also anticipated that there was going to be a lockdown, which would make it difficult for supplies to move in. So these were the main risks related to stocks which we saw. Now, we moved first to have these risks unlocked. First, we had to fulfill our obligation with Gavi and placed 6 months stocks for the vaccines on our program, so that any lockdown opportunity would find that we are good on stocks. And fortunately, by the time the lockdown was introduced, we were able, the cargo planes are allowed to come in, and through that pathway, we're able to receive vaccines, which we need, with through UNICEF. And I am very sure this comes at a higher cost to UNICEF and to the country. So this was the issue of stocks. Now we have stabilized. Number two, we anticipated that there was going to be disruption to service. Disruption to service in the sense that the lockdown would have movement restrictions. The lockdown would affect the way health workers would travel, some of them who use public service. And we also found that the specifically outreach programs would be impeded because of issues to do with the community mobilization for immunization would go down. Now, how we dealt with this? Number one, we sat down to develop specific guidelines for health workers to ensure that they continue providing immunization services and observe the social distancing measures and other infection control measures as they provide the service. Number two, we encourage that there should be no crowding, as is typically the case in immunization places. So we provided guidance of not more than 10 people in the shed, appropriately spaced. And number three, we have also seized this opportunity to continue encouraging the public that if we do not vaccinate now, we risk having a double epidemic or triple epidemic for that matter. So to that effect, we have developed a Ministry of Health sector-wide guidelines for continuity of care. And immunization services is one of the subcomponents, and we are in the process of disseminating these widely, but we have already shared this with our EPI partners in the local governments to ensure that the services continue. Now, what are we already seeing? We are seeing a downward trend in immunization coverage. Our analysis of the first quarter is showing that polio coverage, polio 1, first dose of polio coverage has dropped from the usually high coverage of about 101, 105. It has fallen down to 85%. So this is to say the service uptake is going to be seriously impeded by the lockdown measures. And we also know, that this is just a tip of the iceberg. The month which was under lockdown in Uganda was the month of April, whose monthly returns we have not received. So we are going to see the bigger picture of the impact in the month of when the returns for April come in the second week of May. We'll be able to know the exact extent to which our figures are going to drop, and therefore begin to have an idea of the cumulative number of unimmunized children as a result of COVID. And so we'll be able to factor that and again against how long we'll be under lockdown, to give us an idea of the cumulative number of unimmunized or underimmunized children against which we will require to take future actions. Now, we are also monitoring the surveillance, the vaccine preventable diseases. The most sensitive is usually measles. For us at the moment, the picture is not as clear because of the because last year we did a massive campaign which was very successful, and that that has given herd immunity where we may not see measles as a big problem in the immediate run, but we are seeing sporadic cases, and with the delayed vaccination of all the children, we see the risk of this becoming a big issue in the future. Now, what are our plans? In terms of our future plans, what we are doing is all financial transfers which were supposed to go to local governments, we're going to pause them, because we know that 80% of our children get immunization through static points, 80%. So outreaches at this point where we are not sure of the foci of transmission at this moment, we are doing a survey to ask the question. You may see that Uganda is reporting relatively low numbers of COVID. So we are asking the question, is low really low? And to that effect, we are doing rapid assessments in communities to assure ourselves that there are no pockets. And once we get that a fair assurance of that, then we will start to encourage the outreach programs to start. Otherwise, at this stage, our priority is the containment of spread. I'm not sure the extent to which we can do it. So we're encouraging mothers to go into. But by and large, what am I seeing? What I'm seeing in the future is that the end of COVID will leave us with larger numbers of unimmunized children than what we have now. End of COVID will leave us with the more than one epidemic, which risks to reverse all the gains so far. COVID will leave us in a state where if we have to go back to our pre-COVID immunization levels, we will need to have big catch-up campaigns, big catch-up immunization programs in the form of campaigns where you will have to go on a correctional course. Those who have missed, you update the immunization status. This will again transfer itself into higher demands for vaccines beyond what the recurrent budgets for vaccine stocks per year will be, because the current ones will expire because we don't know how long the COVID is going to last. And to vaccinate the cohort of that year and bring those who have missed the opportunity from behind, then you are talking of an unusual costing for vaccines moving forward.
Wow. Thank you. Thank you very, very, very much, Dr. Driwale, for painting to us that picture for Uganda. I think that resonates with a number of countries and situations in the continent. I think you've really, really talked about, what are some of the key things that you saw that were going to be challenges. We're learning from Uganda the whole essence of being proactive, forward planning, forecasting, and making sure that we are putting in place strategies to mitigate that. You talked about guidelines that you've adopted already to ensure that as much as possible, service delivery for immunization continues. We may want to hear also what is coming, what is happening at the community level, and I'll not ask you to answer that now, but it's also one of the questions. You know, fine, it's good that we are doing all that, but what is happening at the community level? Because what we are hearing also from other contexts is that some communities are actually, you know, going by misinformation that the lockdown means don't go to health facilities, or stay home means stay away from the health facility. So we might want to think about how are we also engaging communities. But I'll move now to, I'm going to move over to Fred from Zambia. Fred, very quickly, would you want to paint to us, you know, the picture of Zambia? Are you seeing the same trends as Uganda, or what is happening there before we come to the data question?
Thank you very much, moderator. At the moment in Zambia, we do not have an alternative immunization service delivery model. From the time we had the first cases mid-March to date, all essential health services are functioning normally. And glad to mention that the Minister of Health during the daily situation reporting, he is actually alluding to the fact that people should utilize the services that the Ministry of Health is offering, as it were. Also wish to mention that we have designated places that have been set aside for screening of COVID-19, as well as designated places for quarantining. However, there are some guidelines that have been put in place, such as that all public places should have sanitation facilities. And also we have restrictions in terms of personal contacts, that is close personal contacts such as handshakes, hugs, and many others. So social distancing is being preached, where people are supposed to maintain at least 1 meter apart, as well as unnecessary public gathering. As already alluded to, as we've heard from Uganda, you know, immunization facilities or immunization sessions, mothers and their babies usually do crowd the places as they come. So these guidelines have been put in effect and they're being observed. We are yet to see the impact of these preventive measures that are in effect on the immunization coverage. What is being discussed, or what is the thinking around tailored immunization services and awareness? The ministry with other collaborating partners are looking at implementing scheduling functionalities within the EIRs, especially that we've helped to scale. The EIR that PATH has supported is in one region of the country, that is southern region, and in one other district in the western region. So there's a thinking around that maybe through the use of the EIR, there could be targeted messaging to mothers so that they could be notified on when to bring their children to avoid overcrowding, as well as also disseminating of key messages regarding COVID-19. So really, in a nutshell, all the services, including immunization, is running as normal. However, these preventive measures that have been put in place.
Thank you. Thank you very much, Fred. Before we go to the participants' question, I think you mentioned a very important thing at the beginning around communication. You know, coming from the highest level of the Ministry of Health to encourage people to, you know, continue seeking services and, you know, that assuring them of their safety even as they go to health facilities. I think you also mentioned about data, how you're using EIR, that is Electronic Immunization Register, to be able to track the trends and therefore, you know, inform action on how to encourage, you know, people to come for immunization. Of course, there are questions of how are we doing that exactly? How are we encouraging families, you know, or mothers or parents to be able to bring their children for immunization? What strategies are we using? So I'll ask you to answer that question, then I'll move back to the other speakers with the questions from participants. Thank you.
So the strategies that are in place, communications through the established channels. We have the health facilities across the nation, as well as the community themselves. From the national level, as I've already alluded to, from the highest level, people are being encouraged to continue utilizing the services that are being provided. Because it's not all the facilities that are COVID designated facilities. We've got those that are designated to screen as well as those that are designated to quarantine. But the other health facilities are providing all the essential health services as it were.
Thank you. Thank you very much, Fred. So I'll go to Dr. Driwale first, then I'll come to you, Dr. Essengue. So there's a question for you, and the question is, in case the COVID pandemic persists longer than expected, of course, you talked about planning for catch-up campaigns, but the question is, what other approaches are we likely to see the program introducing in Uganda to boost immunization uptake and increase coverage to optimal levels? Over to you, Dr. Driwale. Dr. Driwale, do we still have you? Okay, as we wait for Dr. Driwale to come back, I'll pose a question to you, Dr. Essengue. And the question is, a number of Gavi eligible countries were meant to transition between 2019 to 2022. COVID-19 has caused a number of economic disruptions among countries, and Africa widely is bound to be hit hard by the economic recession. What are the plans Gavi is having to cushion these countries from suffering outbreaks from vaccine-preventable diseases out of inability to finance procurement of vaccines?
Thank you very much. Thanks for the questions. Yes, Gavi is aware that there will be a lot of economic disruption because of this COVID situation. What we are doing right now is that we have next week a board call where this will be discussed. And one of the key point that will be raised is about how do we move or forward with those countries that were supposed to transition, but also how do we manage those countries that will not be able to pay for their co-financing, because I hear one of the colleagues, Alfred, mentioned the challenges and that they might see in this case. We have already started seeing some countries with this challenge. So this will be discussed next week. And we made some proposition to the board for consideration. As soon as we have their go-ahead, that will be communicated to countries. And if I may just add one more thing, is not only about the co-financing, but this will also be about what can we do about this, because there was a question around if Gavi will support some type of intensified activities for immunization. And we think that there could be some flexibility that Gavi could explore as far as health system strengthening support is concerned. We have many countries, for example, we will arrive at the end of the current health system strengthening support. So we are thinking about maybe exploring some bridge funding where this will be needed, or even see if this could be some support could be front loaded to country to really help country to tackle this period of time. So that will be different options that will be explored by the board in order really to support countries and help them to face this period, and also moving forward for the recovery phases. Over.
Thank you very much. I think that is really encouraging to know that there is opportunity and flexibility, from Gavi to be able to review the transition plans. And I think everyone is really looking forward to positive outcomes. And of course, just to see that that also influences how countries are able to sustain their commitment. I don't know whether we have Dr. Driwale back. Okay, if we don't have Dr. Driwale, I'll still.
Hello?
Yes,
Hello? Hello?
Hello. Yes, Dr. Driwale.
Yes, I'm back.
Yes, so there was a question for you regarding what strategies Uganda Ministry of Health is putting in place to make sure that, vaccination continues, uptake for vaccination continues, uninterrupted, including, stock and everything, if COVID stays with us a little longer. And yes, you talked about plans for immunization catch-up campaigns, but what else in terms of other additional strategies? I think Dr. Driwale has a challenge with his connection. Are you back?
So I'm back. The problem is I'm using my phone in the field, so I get calls which breaks the lines as well. Hello?
Hello.
Hello, is that better?
Yes, we can hear you.
Yes, so what I'm saying is when we have a sustained pandemic, the immunization will collapse under the strain, economic strain with the other things. But if we get out of this phase earlier, then we will have to go on a very express fundraising drive. First of all, this is a national issue, and I hope at the broader national level there is a recovery program. And number two, we will also have our business, our recovery plan. We will market it to partners, including Gavi. So we are expecting that absorption of grants, HSS funds may go low because some activities may not be implemented. We will seek for their reprogramming into vaccine procurement, in addition to intra-country mobilization for additional resources.
Mm-hmm. Thank you. I think that's really useful to hear. And also being aware. Hello, Dr. Driwale. Yes, now just acknowledging your response.
Yes, I'm aware.
Yes, and just being aware that Uganda actually raised its budget for immunization last financial year. So I think it's positive to hear that the government is still committed to safeguarding this and to working with partners to make sure that funds are adequately secured to make sure that immunization is not compromised. That is really useful. So
immunization is immunization. Hello.
Yes, we can hear you. We can hear you, Dr. Driwale. Yes, we can hear you.
Yes, I'm saying immunization is supported in Uganda by the president personally. So with that kind of political support, when we articulate our needs very well, we will only get the answer no if there is no fiscal space to accommodate the requirements. So I'm very confident that we will raise local resources as well as global resources to meet the gaps as they emerge.
Thank you very much. And I'm sure the people in Uganda will be really looking forward to this and making sure that this commitment still actually is sustained. We are getting closer to the end, but I just want to bring one question to you, Fred, around communities and how do we engage communities? I think there are a lot of comments from participants around how communities are actually, fearing to go to health facilities, because of what is happening, fear and lack of trust. So how do we make sure that we address these issues in the community? What are some of the approaches that are working and can actually be deployed to address this?
Yeah, thank you very much. Yeah, so for the communities, they're being engaged as usual through the established channels that are there. I'm sure in some other districts, they are able to use the platforms such as community radio stations as they preach key messages concerning COVID-19, and at the same time encouraging mothers to take their children to access these services. This is something that is new. It has never happened. So there is that fear amongst the communities, but we need to allay the fears so that they continue accessing the services as it were. I've already mentioned that during the situation reports from the highest level from the Minister of Health, there's that emphasis of using these services. And also there are some guidelines that are being communicated to the sub-national levels for the services to continue, or the people continue accessing the services as they are being provided.
Thank you very much, Fred. And I think you bring an important point about making sure that the guidelines that are being produced are actually addressing fears, myths, and miscommunication and misinformation. I think one of the critical things that we've also seen is the critical role of community health workers, community health volunteers, in making sure that they are actually actively providing the right communication, making sure that they're actually listening to what is happening to the ground and being able to relate that to service providers and the health system for those to be addressed.
Where do you get this chicken from? From a farm or from home?
Dr. Driwale, if you could just mute.
If it is from home, I will eat. If it is from farm, I don't eat. Hey, sorry.
Doctor,
sorry.
I'll come to you with two questions before we give each of you a round of final remarks. And one of the questions is around conflict-affected countries. What do we have, like, specific strategies and approaches that we are using for now to make sure that conflict-affected countries are actually not left behind when we are safeguarding immunization during this time? Dr. Essengue?
Thank you. I was on mute. Yes, I think in Gavi more and more, we are conscious of the fact that we cannot treat all countries the same as we know countries are in different situations, in different status. So now we are having more customized approaches in terms of what is expected from countries, but also in terms of try to look at our internal procedures to make sure that countries are supported as much as possible. And I think one of the lessons that we can also learn from this COVID situation is really in such settings, we need to engage with other type of organization in addition to those that we are already working with. You know, the humanitarian organization are very useful in these settings, and we know there are other partners who have some degree of experience in how to engage in such difficult settings if we really want to reach those who are in need for vaccines and those missed community and missed children. So yes, we have customized approach, and we are willing even to improve as we move forward as part of the Gavi 5.0, which is our new Gavi strategy.
Thank you very much. And now to a final question to you, Dr. Essengue, and thank you very much. So we are all looking towards availability of a COVID vaccine, maybe in the coming year or two. And as you said in the beginning, vaccination, immunization is important and is needed for all of us, not just in Africa. So it is and should be accessed by everyone in the world. So what needs to be done now, and how is Gavi actually supporting countries to make sure that they're starting to think about preparing for a potential COVID-19 vaccine and rollout and making it accessible to everyone?
Yeah, yes, you are totally right. The vaccine is for everybody, not only Africa. All people in the world who need to be protected. This is about saving lives, and this is what I said at the beginning. So I think in this period of the COVID and in preparation for the introduction of the vaccines when they will be available, Gavi now has initiated a proposal to the advanced market commitment to make sure that we guarantee the manufacturing of the vaccine as soon as it will be available, and that all communities in need and people in need will access this vaccine, not only those who can pay, but those who really need this vaccine. So this is something that we are moving on with, these tools which Gavi has used for other vaccine PCVs and other, to make sure that the market is guaranteed and that people can access vaccine. We also monitor the development of the vaccine to see how far it goes to make sure that it's available soon. I would also like to thank colleagues and participants who responded on my question about what we can do regarding these rumors and all misinformation that are going on. And what is really coming out is a joint effort. Everybody should act at its level to make sure that the community, the people receive the right information, using the right channels, and really making sure that we don't miss the current opportunity for people to be aware of about immunization and about vaccine using influenza. And what I also see in the response is that it's not only about only the community, but we should also work on the health worker side, on those who deliver these immunization services, to make sure that both sides are aware and that they can support in this situation. So thank you very much for that.
Thank you very much. I don't know whether we have any just final word from Fred, Dr. Driwale.
Yeah, so I think from my end, what I would say is that partners really should invest or direct resources to scaling up electronic immunization registries in order to assist countries like my country, Zambia, improve the coverage data. And also for the purposes of visibility for the health workers into their coverage rates. And most importantly, targeting the children that would have been missed to immunization, so that targeted care could be placed on those in terms of follow-up of the defaulting children. Thank you.
Thank you. Thank you very much. Dr. Driwale, do we have you still? And if not, I just want to thank you, all of you, and thank you, participants, very, very active. Do we have you, Dr. Driwale?
Yes, I'm here. Looking forward, the ultimate control for COVID. Hello?
Yes, we can hear you.
Hello? Okay. Looking forward, the ultimate control for COVID may require a vaccine. And in Uganda, I'm very optimistic that deployment of a new vaccine in our country is easy because of the structures which we use for bringing communities on board. And now we also have guidelines for which you can follow when you want to deploy a new vaccine, which preempts possible resistances and in the context, in the cultural context. And in that, we were able to even deploy experimental Ebola vaccine in the border districts. So I think for us, once the decision on a good vaccine is already made globally and at the national level, trust me with its efficient deployment.
Great. That's a very, very important point to conclude, Dr. Driwale, and I think it also just points to the need for our regulatory systems and processes to be strengthened and be ready for vaccine when it's available. We are very optimistic that that's going to be available very soon. So with those remarks, I just want to bring this to a close. Again, thank you very, very much, our panelists, our speakers, for sparing your time, Dr. Driwale, just coming from the field where you're actually supporting work on the ground, and Dr. Marthe, Fred, thank you very much. Participants, you've been great. Actually, I can see you responding to each other's questions, and that is great. We encourage these conversations to continue, and we hope to have many more, that this is just the beginning, and that we can have many more and elevate them to be able to make sure that no one, and actually this COVID pandemic does not leave deaths from preventable diseases and vaccine preventable diseases as a legacy. We don't want that legacy for COVID. And I think we all have an aspect to contribute to, and we have work to do. Thank you very, very much. And we will post the recording, and we will look at all your questions, and we hope that this can inform how we move forward with this conversation. Thank you very much, and God bless you.